12 Silent Warning Signs of Sjögren Syndrome You Shouldn't Ignore. Welcome back to another eye-opening educational video. Sjögren syndrome is one of the most underdiagnosed autoimmune diseases, taking an average of 4.7 years from first symptoms to proper diagnosis. The Sjögren Syndrome Foundation reports that this disease primarily affects women, making up 90% of all cases, and typically develops between ages 40 and 60, though it can strike at any age. Here's what most people get wrong: they dismiss early symptoms as normal signs of aging, stress, or seasonal allergies. Many assume that if it were serious, it would be painful or obvious. But Sjögren syndrome earned the nickname, the Great Mimicker, precisely because its early warning signs masquerade as everyday annoyances. Research shows that patients often visit an average of 5 different healthcare providers before receiving an accurate diagnosis. Today, we're revealing the 12 silent warning signs that could save you years of misdiagnosis and unnecessary suffering. By the end of this video, you'll have the knowledge to recognize these often overlooked symptoms and take action before this autoimmune condition progresses further. Let's dive into these critical warning signs that could change everything. Disclaimer: this video is for educational purposes only and is not intended as medical advice. Always consult a licensed healthcare professional regarding any questions or concerns about your health, medical conditions, or treatment options. All information presented has been thoroughly researched and verified. You can find source links in the video description. 1. Autonomic dysfunction, dysautonomia. Autonomic dysfunction represents one of the most underrecognized complications of Sjögren syndrome, affecting the nervous system components that control involuntary bodily functions. Research published in Clinical Autonomic Research demonstrates that up to 60% of Sjögren's patients experience some degree of dysautonomia, though symptoms are often attributed to other causes, delaying proper diagnosis and treatment. Orthostatic intolerance, characterized by lightheadedness or fainting when standing upright, occurs when the autonomic nervous system fails to properly regulate blood pressure and heart rate changes with position. Patients may experience dizziness, weakness, or even syncope within minutes of standing. This symptom can be particularly dangerous for elderly patients at risk of falls. Cardiac dysautonomia manifests as inappropriate tachycardia, where the heart rate increases excessively during minimal activity or position changes. Some patients develop heart rate variability abnormalities or exercise intolerance disproportionate to their physical condition. The European Heart Journal reports increased cardiovascular risk in Sjögren's patients, particularly those with autonomic involvement. Gastrointestinal dysautonomia affects digestive motility, causing symptoms ranging from delayed gastric emptying to bowel dysfunction. Patients may experience alternating constipation and diarrhea, bloating, and unpredictable digestive symptoms. Bladder dysfunction, including urgency, frequency, or incomplete emptying, can also occur. Studies suggest men with Sjögren's may experience more severe cardiovascular autonomic symptoms, though both sexes can develop any manifestation of dysautonomia requiring comprehensive evaluation and management. 2. Dry skin and rashes. Xerosis, the medical term for abnormally dry skin, affects the majority of Sjögren's patients as the disease impairs sebaceous and sweat gland function. Unlike normal dry skin that responds well to moisturizers, Sjögren's-related xerosis often appears severe and widespread. The Journal of the American Academy of Dermatology describes characteristic patterns of dry, scaly patches that typically affect the arms, legs, and trunk most prominently. The skin may develop a rough, sandpaper-like texture with visible scaling and flaking. Many patients notice increased itching, particularly at night, which can lead to scratching and secondary skin infections. The skin's natural barrier function becomes compromised, making it more susceptible to irritants and allergens that previously caused no problems. Photosensitivity reactions represent another dermatologic manifestation of Sjögren syndrome. Patients may develop red, scaly rashes after sun exposure that resemble lupus-related skin changes. These eruptions can occur on the face, neck, and arms, areas typically exposed to ultraviolet radiation. Some patients develop annular erythema, circular red rashes that expand outward while clearing in the center. Research in autoimmunity reviews indicates no significant gender differences in skin manifestations of Sjögren syndrome. Both men and women should monitor for persistent dry skin that doesn't improve with standard moisturizing treatments, especially when accompanied by photosensitive rashes or unexplained circular skin lesions. 3. Raynaud's phenomenon. Raynaud's phenomenon affects approximately 30 to 50% of Sjögren syndrome patients, representing a significant vascular manifestation of this autoimmune disease. This condition involves episodic vasospasms of small arteries in the fingers and toes, triggered by cold exposure or emotional stress. The Journal of Rheumatology describes the characteristic triphasic color changes: initial pallor, white, as blood flow stops, followed by cyanosis, blue, from deoxygenated blood, and finally reactive hyperemia, red, as circulation returns. These episodes typically last minutes to hours and can be extremely painful. Patients describe numbness, tingling, and burning sensations as blood flow is restored. In severe cases, recurrent attacks can lead to digital ulcerations or, rarely, gangrene of fingertips. The pain can be severe enough to interfere with daily activities like typing, writing, or handling cold objects. Raynaud's in Sjögren's patients often indicates more extensive systemic involvement beyond glandular dysfunction. Research in autoimmunity review suggests that patients with both conditions have higher rates of other organ system involvement, including pulmonary and renal complications. The presence of Raynaud's may signal more aggressive autoimmune activity requiring closer monitoring. While Raynaud's phenomenon affects both sexes with Sjögren's syndrome, studies indicate slightly higher prevalence in women, consistent with general autoimmune disease patterns. The Annals of the Rheumatic Diseases reports that men with Sjögren's who develop Raynaud's may have more severe vascular complications, emphasizing the importance of vascular protection measures regardless of gender. 4. Chronic dry cough and bronchitis. Sjögren's syndrome affects mucus-producing glands throughout the respiratory system, leading to chronic airway dryness and inflammation. This results in a persistent, non-productive cough that differs significantly from typical cold or allergy-related coughs. This cough typically produces no phlegm or mucus, earning the description dry cough. Patients often describe it as irritating and exhausting, frequently worse at night when lying flat. The lack of protective mucus in the airways creates vulnerability to irritants, making the cough more pronounced in dusty environments or around strong odors. Chronic bronchitis may develop as inflammation persists in the airways. Unlike infectious bronchitis that resolves with treatment, Sjögren's-related bronchitis tends to be ongoing and resistant to typical treatments. Some patients develop bronchiectasis, a condition where airways become abnormally widened and scarred due to chronic inflammation. Research published in Rheumatology International suggests that men with Sjögren's syndrome may experience more severe respiratory complications than women. Male patients show higher rates of interstitial lung disease and bronchial hyperresponsiveness. This gender difference emphasizes the importance of respiratory symptom evaluation in all Sjögren's patients, but particularly in men who may face greater risk of pulmonary complications requiring specialized treatment. 5. Dry eyes, keratoconjunctivitis sicca. Dry eyes represent the most recognizable hallmark of Sjögren's syndrome, yet many dismiss this symptom as simply getting older or spending too much time on screens. The medical term keratoconjunctivitis sicca describes inflammation of both the cornea and conjunctiva due to inadequate tear production. Research published in the Archives of Ophthalmology shows that Sjögren's patients produce tears with altered composition, not just reduced quantity. Patients typically describe a burning, gritty sensation, as if sand particles are trapped under their eyelids. The eyes may appear red and feel sticky upon waking. Unlike temporary dry eyes from environmental factors, Sjögren's-related dryness persists throughout the day and worsens in air-conditioned spaces or windy conditions. Inflammation can progress from discomfort to serious complications such as corneal defects, scarring, vision loss, or even perforation if untreated. Women report symptoms about 9 times more often than men, but studies suggest men may underreport early issues and present with more advanced eye damage, underscoring the need for early recognition in both genders. 6. Dental caries and oral infections. The absence of protective saliva transforms the mouth into an environment where harmful bacteria thrive unchecked. Dental caries, commonly known as cavities, develop rapidly and extensively in Sjögren's patients due to loss of saliva's natural antimicrobial properties. Studies published in Clinical and Experimental Rheumatology show that Sjögren's patients develop cavities at 3 times the normal rate, often requiring extensive dental rehabilitation. These aren't ordinary cavities that develop slowly over months or years. Sjögren's-related dental decay can progress aggressively, affecting multiple teeth simultaneously. Patients may notice new cavities appearing despite maintaining good oral hygiene. The decay often occurs in unusual locations, such as the necks of teeth near the gum line, rather than the typical biting surfaces. Oral candidiasis, thrush, is common in Sjögren's patients with dry mouth. It appears as white patches that don't wipe off, and up to 60% develop recurrent infections due to altered oral pH and reduced saliva defenses. Both men and women face equal dental risks from Sjögren syndrome, but women may seek care sooner, reducing damage. A key warning sign is sudden, multiple dental issues with persistent dry mouth. 7. Dry nose and sinusitis. Nasal dryness occurs when Sjögren syndrome affects the mucus-producing glands lining the nasal passages and sinuses. This creates a cascade of problems beginning with loss of the protective mucus layer that normally traps bacteria, allergens, and debris. The International Forum of Allergy and Rhinology reports that chronic rhinosinusitis affects approximately 40% of Sjögren's patients, significantly higher than the general population. Patients typically notice a persistent dry, crusty feeling inside the nose, often accompanied by frequent nosebleeds from fragile, irritated nasal tissues. The normal mucus that keeps nasal passages moist and clean becomes thick and scanty, leading to crust formation. These crusts can be difficult to remove and may cause pain or bleeding when dislodged. Chronic sinusitis in Sjögren's arises from failed mucus barriers and blocked drainage, differing from typical infections by its persistence and lack of bacterial growth. Symptoms include facial pressure, headaches, and congestion unrelieved by decongestants. Reduced nasal humidity can impair smell, hyposmia or anosmia. Studies show nasal symptoms affect men and women equally, with the hallmark being persistence despite treatment, often alongside systemic dryness. 8. Gastrointestinal symptoms. Sjögren syndrome frequently affects the digestive system through multiple mechanisms, creating a complex array of gastrointestinal symptoms that often precede the classic dry eyes and mouth. Research published in Gastroenterology Research and Practice indicates that up to 70% of Sjögren's patients experience significant digestive problems, with gastroesophageal reflux disease being the most common manifestation. Reduced saliva production affects the first stage of digestion, making it difficult to properly break down food and neutralize stomach acid that refluxes into the esophagus. Patients frequently report severe heartburn, regurgitation, and a sensation of food sticking in their throat. The lack of protective saliva allows acid to damage esophageal tissues more readily than in healthy individuals. Gastroparesis, caused by delayed stomach emptying, is common in Sjögren's due to autonomic nerve involvement, leading to bloating, nausea, and vomiting. It often goes undiagnosed for years. Another complication is autoimmune pancreatitis, marked by chronic pancreatic inflammation, enzyme deficiency, and diabetes risk. Women report GI symptoms more often, possibly due to hormones or healthcare-seeking patterns, but both sexes can develop serious complications needing specialized care. 9. Vaginal dryness. Vaginal dryness affects the majority of women with Sjögren syndrome as the autoimmune process targets mucus-producing glands throughout the body, including those in the reproductive tract. Research published in Menopause indicates that Sjögren's related vaginal dryness often occurs earlier and more severely than typical age-related changes, significantly impacting quality of life and intimate relationships. When vaginal moisture decreases, the epithelium becomes thin, fragile, and inflamed, causing burning, itching, and irritation. The altered pH increases risk of recurrent yeast infections and bacterial vaginosis, often resistant to standard treatments due to the autoimmune process. Dyspareunia, or painful intercourse, is a common result of vaginal dryness in Sjögren's patients. Reduced lubrication and tissue fragility can make sex uncomfortable or impossible, straining relationships and lowering desire. Research shows women with Sjögren's report lower sexual satisfaction and quality of life, especially postmenopause when hormonal changes worsen symptoms. Early use of lubricants, moisturizers, or hormonal therapy can greatly improve outcomes. Autoimmune pancreatitis is another complication, causing pancreatic inflammation, enzyme loss, and diabetes risk. Women often have more GI symptoms, though both sexes may need specialist care. 10. Chronic prostatitis. Chronic non-bacterial prostatitis affects a significant percentage of men with Sjögren syndrome, representing the male equivalent of vaginal dryness in women. This condition involves chronic inflammation of the prostate gland without evidence of bacterial infection, creating persistent pelvic pain and urinary symptoms. Research in prostate cancer and prostatic diseases indicates that men with Sjögren's develop prostatitis at rates significantly higher than the general population. Patients may have deep pelvic pain radiating to the back, testicles, or thighs, often worse with sitting, activity, or stress. Unlike bacterial prostatitis, it doesn't improve with antibiotics and may last for months or years. Urinary issues include frequency, urgency, weak stream, and nocturia. Sexual problems, painful ejaculation, low libido, or erectile difficulties are also common, greatly affecting quality of life. The International Journal of Impotence Research reports that chronic prostatitis in Sjögren's patients often goes undiagnosed for years as urologists may not consider autoimmune causes. Men with chronic pelvic pain, particularly when accompanied by dry eyes or mouth, should be evaluated for Sjögren's syndrome. This condition occurs exclusively in men and may be the presenting symptom that leads to Sjögren's diagnosis, especially in male patients who might otherwise dismiss mild sicca symptoms. 11. Fatigue and cognitive dysfunction. Chronic fatigue represents one of the most debilitating yet underappreciated symptoms of Sjögren's syndrome, affecting up to 90% of patients according to research published in Rheumatology. This isn't ordinary tiredness that improves with rest, but rather a profound exhaustion that interferes with daily functioning and doesn't correlate with activity level or sleep quality. Fatigue in Sjögren's syndrome stems from chronic inflammation, poor sleep due to dryness, and possible autoimmune effects on the brain. Patients often feel exhausted despite rest, with flu-like tiredness that comes and goes unpredictably. Many also experience brain fog, with memory, attention, and processing speed impairments. Patients report trouble concentrating, forgetfulness, and word-finding issues. These neurological symptoms can be as disabling as physical ones, sometimes appearing before other signs of Sjögren's. Both men and women are affected, though women report them more often. Recognizing fatigue and cognitive dysfunction is key to better care and quality of life. 12. Dry mouth, xerostomia. Xerostomia, or dry mouth, occurs when salivary glands fail to produce enough saliva. Unlike temporary dryness from dehydration or medication, Sjögren's-related xerostomia is persistent, often leaving a cottony or sticky feeling. Normally, people make 1 to 1.5 liters of saliva daily, but Sjögren's patients may produce less than half. This reduction causes chewing, swallowing, and speaking difficulties, while loss of saliva's cleansing action allows bacteria and fungi to grow. Without saliva's protective enzymes, antibodies, and minerals, the mouth becomes prone to infection, decay, and pH imbalance. Patients often notice a swollen, cracked tongue and painful fissures at the corners of the lips. Research in oral diseases indicates that while both sexes experience xerostomia, women report more severe symptoms and earlier onset. Male patients may initially attribute mouth dryness to lifestyle factors like smoking or alcohol consumption, potentially masking the underlying autoimmune process. Regardless of gender, persistent dry mouth accompanied by difficulty swallowing or frequent dental problems warrants medical evaluation for Sjögren's syndrome. Subscribe to the Human Health YouTube channel for more insights. If you found this content helpful, please like, share, and comment below.